welcoming Sapna Nand to this interview today. I am so thrilled that we can meet to discuss how to prepare for your ophthalmology appointment. So on the Facebook Live, just write live if you're live, do replay if you're watching this on replay. We know a lot of people around the world actually come onto our Facebook Lives and they watch them in their own time zone. So that is just absolutely awesome. It's all about adding value to those in our community who have burning questions. And talking about questions, I would love you to pop your questions in the chat. I will be moderating that and finding those questions ready to ask Sapna after she presents to you. She's going to be presenting some slides, all the information as an educator about how to prepare for those ophthalmology appointments that you need to go to. And also I will be asking those questions that come in on the chat. So don't be shy, put them in the chat and I will make sure that Sapna gets them. So welcome to our Facebook Live, Sapna.
Hi, Annie. So I am very excited to be doing this presentation today. I feel this will benefit any patient going in for an eye check, so whether it be their first or a follow-up appointment. So today we'll go over some helpful hints on how to prepare for your appointment and what to expect when you're there.
Fantastic.
So I'll just start sharing my slide. Can you see it? Yep, there you go. So, glaucoma is a lifelong condition. You need to ensure you're comfortable with everyone in your support network and feel confident about the decisions made regarding your eye health. It starts off with choosing the right eye care professionals for yourself, establishing trust in their expertise so that you understand and adhere to your ongoing treatment and management plans to save the health of your eyes and maintain your quality of life. Now, as the condition is lifelong, so are the ongoing appointments with the optometrist and your ophthalmologist. From my clinical experience and also from the conversations we have with patients supported by Glaucoma Australia, there is quite a bit of uncertainty and anxiety when it comes to the upcoming appointments. We often hear questions such as, I hope my eye pressure is fine next visit. What if it's not? I feel so nervous. Then we hear, I have no idea what my appointment's about. What will they be looking for? As a patient educator, my goal is to help our patients understand how important it is for them to attend these appointments, whether it be their first or a follow-up one. We also want our patients to have a clear understanding of the glaucoma test. So not just the eye pressure, but you've got your visual field test and the OCT scans. It is important to understand, why is it done? What does it show? Why are they often repeated? We want our patients to not feel nervous about the outcome of their test results, but instead have a clearer understanding of what the results mean for them. How does it impact the treatment plan from here on? Glaucoma is a progressive condition, meaning the test results can change over time. And the only way to stay on top of it is by attending your appointments. Patients mention feeling uncomfortable or unsure about which questions to ask their specialist, and if it's okay to ask them. The entire process can sometimes be very overwhelming, and they are not alone in feeling that way. So I always encourage our patients to ask the questions. The better understanding you have about your eye health, the more confident you will feel about your treatment plan. So today we will go over some questions patients can ask during their appointments to help them better understand the reason and the outcome for their appointments. It does help to write out your questions ahead of time. Your optometrist or your ophthalmologist will attend to your questions. You just have to ask. Most glaucoma patients have been through at least one appointment where they have felt like nothing happens. They say it's the same. In this case, try asking questions such as, why were there no changes? What does that mean for me? Is it a good thing? Is it a bad thing? In most glaucoma cases, it's usually a good thing. When it says there's no changes, it's a good thing. It means your glaucoma is stable, your treatment is working. If laser or surgery is suggested, don't be scared or nervous. Find out more. Why do I need it? How does this procedure help my glaucoma? At Glaucoma Australia, we encourage individuals to take an active interest in and understand their own eye health. We want our patients to feel prepared for their upcoming appointment. We want them to have confidence in their eye care professional. We want them leaving the appointment feeling well informed and empowered that they have their glaucoma under control. We would like them to have a clearer understanding on how to save the vision from glaucoma. So on the Glaucoma Australia website, we have a checklist prepared for you. Outlined here are steps on how to find it. So if you just go onto our website, you have to click on I have glaucoma, find brochures and fact sheets, scroll all the way down, and you'll come across this document right here. It can be downloaded or printed, whichever one is easier. And this can be your guide on how to prepare for your appointment and what to expect once you're there. There are some important things to consider before going to the appointment. Your transport there and back, and especially if you are having eye drops that dilate your pupils. If unsure, give the clinic a quick call a day ahead. Now, dilated pupils can cause blurry vision. It can make you sensitive to light glare. This can last 2 to 4 hours or longer in some cases. This can make it quite unsafe to drive back by yourself. You could consider arranging someone to pick you up. You can use public transport. Some people wait around the clinic and wait for the drops to wear off until they can see better. Sorry. Wearing sunglasses helps with the light glare. And also try getting there a few minutes ahead so you can allow time to find parking. Okay, to make things a lot smoother, there is a list of things you have to take with you on the day. Make sure you have your referral from your GP or optometrist with you. This is needed for new patients and also for return patients if your previous one has expired. Remember your Medicare card, pension card, Veteran Affairs card, any health fund cards you might have, credit card or cash if you are aware of a gap you have to pay on the day. If you have done some extra testing at the optometrist or any other eye clinic, try to take these with you on the day. The test may still be repeated though, just to compare the results. Take all the glasses you wear daily. So you may have your distance, readers, multifocals. If you are getting new glasses and you have to yet pick them up, you can take the prescription on the day as well, because that will still be quite helpful. Try and take in a good book, audio if possible, especially if you're getting dilated. iPads, smartphones for movies or browsing the internet. Headphones help so you can keep your sound to yourself in the waiting room. All right, it also helps to take a list of your most recent medications, including the dose. If possible, take your medications with you, especially for glaucoma eye drops and any other eye drops you use. Take note of any new allergies you have since your previous visit. Take your last blood sugar level reading if you are diabetic. If you are new to the clinic, it will help to have a report with your medical history, also a family history of any known health conditions. Okay, so once you get to the clinic, try to be there at least 10 minutes before your appointment time, just in case of any extra paperwork needed to be filled out on the day. Please be patient. Allow a minimum of 2 hours for your appointment. Now, your appointment time indicates the approximate time your testing will start. This may be performed by an orthoptist or an ophthalmic nurse. You will be seeing the ophthalmologist after the testing is completed. All your results will be ready for review by the time you see your ophthalmologist. You may be done well ahead of the 2 hours allocated time, but you never know if there is an emergency case ahead of you. If there are more than usual patients waiting for extra tests on the machine you're to be tested on, your eyes might take longer to dilate this time. The staff are always working very hard behind the scenes to get all patients out as soon as possible, but it is important that they have the time to attend to all patients as needed. Depending on the individual results for the day, more testing may be needed in case there is a need for change in treatment plans. Your specialist would not request extra testing if it wasn't needed. So please be prepared in case an extra test is needed, or for more accurate results, you could be repeating a test already done. If you are preparing for your first appointment, it helps to know the answers to the following questions. Do I actually have glaucoma? Now, getting tested for glaucoma does not always result in a simple yes or no answer. You could have narrow angles. You could have ocular hypertension. You could remain an ongoing suspect. If the answer is yes, you should ask what type of glaucoma you have. This is important when it comes to decisions about other medications and lifestyle choices. It will also help when informing your family on what they should be tested for. You can ask, do I have optic nerve damage? Is it one eye or both eyes? Do I have any visual field loss? How does this affect my daily activities? What treatments are available to me? What are my short-term and long-term management plans? For follow-up visits or an existing diagnosis, it helps to ask the following. Is my glaucoma stable? How is my eye pressure this visit? Is there any progression on my tests? So you've got your OCT test and your visual field test. Are there any changes to my current treatment? Do I carry on with my current eye drops? Are there any changes to my long-term management plan? Are you thinking of laser or surgery down the track for me? Most glaucoma patients are on eye drops. So if you get prescribed new drops on the day, or you may have some questions about the existing ones, it helps to ask questions such as, how long will I need to take these drops for? What do I do if I forget them? Are there any side effects to be aware of? What do I do if I'm concerned about the side effects? Do I stop them? Do I contact the clinic? Do I make an urgent appointment? So what happens if you are told it's time for laser or surgery? Eye drops alone may no longer be enough to lower your eye pressure. Your list of questions will most likely be longer, and your specialist will give you time to think about it. To help with your decision, you will need to know the name of the procedure, how soon it has to be done. How will this help you and for how long? Are we talking months? Are we talking years? What risks are involved, and are you at a higher risk? The cost of the procedure. What other options do you have if you decide not to go ahead with this one here? Will you still need your glaucoma drops afterwards? Call Glaucoma Australia if you need to, and we are here to talk to you through it. So hopefully all goes well, and we leave the clinic feeling reassured and well informed. Don't forget to take note of if you need a referral, the next visit, the date of your next appointment. Ask for a repeat script of your eye drops if you need one. After your appointment, just in case you forget to ask a question or if you need clarification on something, you are more than welcome to contact Glaucoma Australia. We will try our best to answer your questions or advise you of your next steps. We are also more than happy to go over the outcomes of your last appointment to help you better understand your diagnosis and your treatment. There are a few ways to contact us. So we have our free support line. We have a web chat on our website. You can email us. You can send us a message via Facebook Messenger. We also have Instagram. You can also post in the support groups we have set up online. Thank you for listening to me today. I'd like to quickly thank Nancy Lee for creating these amazing sketches for the presentation. Nancy is a final year optics student at UTS, so some of you out there might be seeing her at your eye clinic. And that's it from me.
Absolutely fantastic. Thank you so much, Sapna. What an amazing presentation. And I can see people commenting on the chat already wanting a copy of the recording, which is not surprising because there was just so much content in that presentation. Oh my goodness. So those who are in the chat, yes, this will be, you'll be able to watch this on repeat on our Facebook Live. And yes, it will also be on our Glaucoma YouTube. You will be able to get a link for that. So thank you for asking those questions. And thank you so much, Sapna, for showing the reality of how apprehensive you could feel. Like how, if this was me and I'm going to my first appointment, I don't know what's going to be discussed. I don't know if I'm going there just to be told everything's the same, or if I'm going to have some, suggested laser. What if they did that laser on the spot? There's so many things. And I think it's really great having these conversations, and particularly having our patients listening in going, you know what, everyone feels this way. It's the unknown. It can be really, really scary for some people, but just overwhelming. It is overwhelming because with so many things you actually can plan it, if you know what you're going in for. Whereas an appointment, that's it. You could go and just be having your regular monitoring, and you've got those patients who are saying, oh, same again. Is this necessary? And then you've got the other people going, oh, I wish I knew that because I wasn't prepared. And so I absolutely love it. And I'm not surprised people are coming in on the chat and actually asking, can I watch that again? Because there was so much information there. I'd love to touch on a few points that you made. The concept of referrals. So you mentioned in your presentation that, you need a referral. Many people will sort of say, and I know that's come through the hotline, well, what if I arrived and I didn't have my latest referral? And also, if they know I've got glaucoma, why do I have to keep getting referred every year? So can you just address that question starting up, and then I'll try and get
started. So to see an eye specialist in Australia, you need to have a referral. The main reason for the referral is so you can claim from Medicare. Referrals can be indefinite. But you definitely need one as a new patient, and they do expire over time as well. In the case you forget one, it's okay. You can leave the clinic, you can send it in, you can email it through to your clinic, you can drop it in later. These days you can scan it and email it through, text it through. You can ask your GP or your optometrist to just backdate it for you as well, so that it is dated to the date of your appointment. But it's more for the Medicare purposes and just a referral system between our health professionals.
Okay. Oh, thank you for explaining that, because I can imagine when it's a big effort, often, going by public transport if you're worried about getting dilation and so forth, and then you get there and they think, oh no, I've forgotten a referral, or I wasn't aware I needed a repeat. So I think that's super important to know. And yes, people are there and appreciate that these sorts of things happen.
That's right. You will still be seen. You can just send it in later.
We've got a question coming in from Shannon asking, do you have any hints or tips on how to survive the visual field testing? It's one of those things that you get done so often, but you can feel apprehensive. You can be thinking, how do I prepare myself better? Can I do better if I try harder? What's your tips there?
So I think the main thing to understand is how important it is. It's a long test. It's not fun for the patient or the person setting it up. But it's very important in monitoring just your visual field, just to make sure that we are on the right track for your treatment and the progression, make sure everything's, going well for you. Be comfortable. So if you are uncomfortable on the test, let the orthoptist or the ophthalmic nurse know, I need my chair adjusted. The chin rest is quite high. It's a bit hard. Blink, breathe, don't hold your breath. You can pause the test by just holding down the buzzer. So if you need to communicate, go ahead and do that. If you need to cough, if you need to sneeze, you can do all that. Blink, breathe, just look straight ahead at the lights. But the main thing is to communicate between yourself and the person setting it up for you. And, the better the patient is at doing the test, the quicker it actually is. So the more unreliable the patient is, the longer the test goes for. So if you just focus on just getting it right and just relaxing and just understanding the importance of it, you will get through it. It's once a year, it's twice a year. you will get through it.
You definitely will. And I love that response. What I absolutely love is your language. The language that you use throughout your presentation and even the way you're answering it is really encouraging patients to be very proactive with their own care. And I really love that many people kind of, you might be thinking, okay, well, I had questions, but I didn't answer them because I assumed they'd tell me things if I needed, or I didn't feel comfortable, asking them to pause, or can I just refocus and things like that. And I love the way you're sharing, actually saying, if you've got a question, please ask, let them know. They're there to actually make you feel as comfortable as possible, and you're actually going to get better results by doing so. So I really appreciate that, and I'm sure those listening in have as well. We've got some lovely feedback, really great information, says Mara. Gayla and Suzanne are also saying that they have indefinite referrals. So those people who might, are still on annual referrals, you might definitely want to inquire about that. That would be super helpful, because how quickly does a year come around? Absolutely. What about those people? You touched on the fact that, you might have you might have been aware that you were having your eyes dilated, and so therefore made some travel plans to and from the practice to be able to do that. And then sometimes they can spring things on you. You just don't know. And so what is your advice? How long do you feel like people should wait after dilation before they actually do choose to get back into a vehicle? Or also maybe should they just call a friend or get an Uber, so forth?
Okay. It depends on the individual. So getting your pupils dilated actually affects your near vision more than your distance. So if you're a first-time patient and you don't know what it feels like to have your pupils dilated, I would suggest just arrange transport. Patients who have been to an appointment 100 times plus, they do know how comfortable they are. If it's like an evening drive, if you know the roads, if the sunglasses help, if one eye is dilated, that also helps. So I would say it just really depends on the individual. But if you are going in for the first time, if you're getting laser treatment done, if you're not comfortable driving, as it is, like say unfamiliar roads or in traffic or in bad weather conditions, don't take the risk. You can wait around for an hour or so. It does eventually go down. So even with dilating drops, there are stronger ones and weaker ones. You can let them know, I'm planning on driving today. Do you mind putting the weaker ones in? So they do put double drops in sometimes. So you might still need them for, say, a dilated eye examination or a laser treatment. Sometimes it is needed. Sometimes you can get away with the mild dilation. So 2 to 4 hours is general, but it just really depends. Like brown eyes get affected differently to blue eyes. So if you're a first-time patient, don't take the risk. If you're uncomfortable, don't take the risk. Just wait around, see how you go. If you've done it before, you know how it goes.
Exactly. Fantastic advice. I'd also love to ask you to explain the blinking technique a little bit. I know we're all over the place, but we've got lots of questions coming in. That concept that if you're doing a visual field, you mentioned blinking.
Blinking, yeah. Even if you're getting your eyes tested, like for, say, vision testing. So when you blink, a tube film goes over your eye actually, your vision clears up. If you hold your blinks, your eyes will dry up, it will get watery, it will affect your vision. So blink as normal, because that actually helps to keep your vision clear. It reduces, dry eyes. If you know you've got dry eyes, you can always even request some lubricating eye drops for starting a field test as well. Your orthoptist can do that as well. It's actually a good technique to keep you comfortable throughout the test.
I think that's fantastic advice, actually, because after I had a visual field test, I was so concentrating on what to do.
Because you don't want to miss a blink.
Right.
Like
I don't want to miss it, and I don't want to blink. Whereas what you're actually saying is, hey, you can take your time, you can pause, you can blink, and it's a good thing. So it takes that stress, anxiety, and all those other things out of the way, and says just be as relaxed and as comfortable as possible, and also be confident enough to actually, if you pre-lubricate, it's actually going to be a good thing, not a bad thing. We've got an interesting comment come in from Mandy, who said that her specialist doesn't put dilating drops in, and why are they necessary? Why would some choose to put the drops in and others not?
So getting your pupils dilated allows the ophthalmologist to have a good look at your macula, your retina, your optic nerve on the microscope. But with technology like OCT, we can still have a look at the back of it. We can still get the scans done. You can still get the information. Sometimes, say for glaucoma patients, your eye specialist might find it risky if you have really narrow angles. It actually might be risky for you to get your pupils dilated, especially if you haven't had the iridotomy laser. So there could be a few reasons for that. But we do have the technology these days to get the information we want. Certain times it is important to get your pupils dilated, but you can definitely get away without it as well.
Yeah, it's just an extra technique of being able to see really, really clearly. But if you can't have that, or your doctor doesn't do it, it's not as if they're not checking you properly. Just means that
they have the information they need. That's all that is.
Yeah, fantastic. You mentioned the timing, and I know that this comes through our inquiries line a lot. Well, why does it take so long if it's an appointment for a short period of time? You mentioned at least get yourself there early and free up 2 hours. And I know in some areas where they've got emergencies could come in, or they've got a backlog of appointments, it can take it even longer than that. And so is that common? You've been obviously working as an orthoptist for a long time. Is that normal? Do people appreciate why, or are they often sort of concerned, if I go to the GP and I have an appointment at 10:10, I'm expecting to be seen within 10 minutes of that?
It's really hard to predict when you'll be seen. And like I said, you might need extra testing yourself on the day. So due to your extra testing, the next person just gets pushed 10 minutes past. Everyone's there for the same reason, to have their eyes checked to save their vision. So, sometimes you might be lucky. It's pretty in and out. You might not need extra testing. You might not need eye drops, but there could be someone ahead of you who just might need that extra part. The eye specialist might need to spend extra time with someone. It could be a new diagnosis. It could be somebody needing surgery who has more questions than yourself. Also, you might find sometimes in your public eye clinics where you have a higher volume of patients compared to a smaller private clinic where they book less patients. So allowing that time just allows you to plan your day as well, and allows everybody else to get their eyes tested the right way as well.
Yeah, I think we all need to be extra understanding, because that's right. There's so many variables in anyone's clinical day, and when you're a patient, and we've all got things to do, but we appreciate that sometimes the time frame is very challenging. We just have to be patient. One thing that possibly surprises people is like, well, why don't they know what tests I'll be having next time? How can you prepare yourself? So that unexpected, that you could actually go in and have been treated with drops for maybe a number of years, and all of a sudden on that appointment they say, I think we should have laser. Or they might say, okay, we're at another stage, I want you to have an extra battery of tests of some kind, maybe something that you weren't expecting. Are people surprised, and is that normal practice that the physician actually looks at, on that day they just decide there's something specific that they need to test or explore, which is hard to predict?
So most of the time, you would know what test you're getting the next appointment. So how it usually works is that your eye specialist will see you on the day. They will schedule in your next appointment, and somewhere in your notes, they will scribble in what test you're getting done that day. I would suggest always ask reception, because they are aware of it. They book you in, and that's how your time is allocated as well. Now, as we mentioned, glaucoma is a progressive disease. So let's just say you go in one day and it's just an OCT scan, no field test. But what if your OCT looks a bit different that day? Your specialist would like to know, has it made any difference to your field test now? So they might add that in. And like I mentioned before, so they will not ask for an extra testing if it wasn't needed. All of this information goes in together to plan your treatment and to ensure that your glaucoma stays stable.
Fantastic advice. Absolutely. And if in doubt, yes, exactly. That's why you're going to your specialist. They'll be testing or retesting because it's necessary. And there's one thing that I have definitely learned along my time in this role is that every patient is very unique, very specific.
That's it.
It's hard to predict. You could be sitting alongside, someone else who goes to appointments, and they'll have a totally different path, different speed of how often they're tested, what types of treatment they're having, what drops they're on, and so forth. What do you encourage people, just to finish up now, what do you encourage people who might have got a little bit out of their routine with, with COVID and closures and might have even missed an appointment and be thinking, well, is it as necessary as I thought before? What's your advice to them?
So yeah, we still have quite a bit of patients calling up quite concerned about the COVID situation, and they've missed the last 2 appointments for the year. I would say call up and make the appointment. Things are getting back to normal. If you can't get to your specialist, at least go and see your optometrist. Your optometrist is the most convenient way. They are local to you as well. Just call up, check for an appointment time, go in, get all your testing done. They can advise you if you need to urgently book an appointment with the specialist, or you can delay it a bit more if you are still quite concerned about vaccinations and going out and just trying to keep COVID safe as well.
Fantastic. Yes, always stay healthy, but we are, all practices are opening up. Definitely you want to try and get to as many appointments as are scheduled for you because they've been done so for the right reasons. And so thank you so much for sharing with us today, Sapna. That was so much information. For those listening in who have not yet downloaded that document that Sapna was sharing, once again, you can rewatch this video. I'll also go to the Glaucoma Australia website and there is a handout on how to prepare for your ophthalmology appointment. It's super helpful, super valuable. I also encourage you definitely to take a pad and pen and write those questions down. You could hear in Sapna's language how important it is to actually be proactive and prepared in your questioning. Ask those questions. Nothing's a wrong question. Definitely nothing's out of bounds. Just ask your physician. They would actually love that you're being interested in your care and that you're asking for those things. So feel more empowered. Always know that you have access free to Sapna and our education team. So you can just contact via the website, the web chat, email, or Facebook groups. Just say that you'd love to speak with Sapna and she will make herself available to you. And finally, also, we have a fantastic fundraising challenge coming up for Glaucoma Week, which is the 6th to the 12th of March. It's only a couple of weeks away now. So if you haven't yet done so, go to sevensights.org.au. You can register there. It's free to register. It will explain what our challenge is. It's a fantastic challenge that we get out and about in our local area. You can do it anywhere in Australia. You can actually do it anywhere in the world, those listening in from overseas. And the encouragement is that when you're taking photos in your local environment, you're uploading them to our website, you're also encouraging people to actually support Glaucoma Australia in the free service provision that we give to all of our patients so that we can keep the very high standard of care that we provide. So I look forward to doing that challenge with all of you. Thank you so much, Sapna. Incredible presentation, lots of valuable information, and I hope those listening in that you feel more prepared for the next appointment that you go to.